So my clinical practice and surgical practice is restricted to patients with oral cancer. Now, the problem with oral cancer is that it commonly metastasizes to the head and neck region, which means not only do I have to remove the cancer, but I have to do what's called a neck dissection. Almost all of my patients are oral cancer patients. And the treatment for oral cancer is surgical. Sometimes we use radiation and chemotherapy after, but not always. Those cancers don't respond well at all to just radiation and chemotherapy as primary treatment. There are some cancers of the head and neck, like the larynx, oropharyngeal cancer, which is tonsillant base of the tongue, farther down than the oral cavity. Those cancers, some of them will respond to radiation and chemotherapy. But for my patients, it's surgery, sometimes with radiation and chemotherapy. So it turns out that about 10 to 15%, and this isn't my own practice, this is everyone's practice, about 10 to 15% of patients that have a neck dissection, which is necessary with oral cancer, complain of this lagging pain that is quite vague. It prevents them from turning their head. They have difficulty raising their shoulder. It really affects neck and shoulder function. We don't know why it occurs. Like I said, it's only about 10 to 15%. Usually my patients are so happy to have the cancer out, the pain goes away. But like I said, about 10 to 15% of patients will have the neck pain. The only thing that I found that works for that, and that's just because so many patients told me this in the Bay Area where I used to practice at UC San Francisco, was acupuncture, which is really common in the Bay Area. And I tried multiple medical approaches. I sent the patients to palliative care experts, but a couple of them just went out on their own and did acupuncture, and they say it works. And there's now publications in the literature for postoperative neck pain that acupuncture works. The real challenge I have in my practice are those patients who have had surgery, will fail, and the cancer comes back, and there's nothing we can do for them. And patients die a very difficult death with oral cancer, and they now have this, 10 to 15 month